On March 5th, in regard to the coronavirus epidemic, the Surgeon General, Dr. Jerome Adams, emphasized preparation over panic, facts over fear. This video will present you with some basic facts and tips for preparation to best deal with this epidemic.
Dr. Terry Shintani, Director of Preventive Medicine.
Hi, this is Dr. Shintani for your health. The coronavirus gets its name from its coating that has tiny projections on it that resemble a crown, something like a solar corona during an eclipse. We should not be calling it the coronavirus because it can be confused with several other well-known deadly coronaviruses identified in the past, such as MERS, or Middle Eastern Respiratory Syndrome, that started in 2012, and SARS, or Severe Acute Respiratory Syndrome, discovered in 2002. The current coronavirus is actually another SARS virus because it produces severe acute respiratory syndrome, but it is now formally labeled COVID-19, or virus that causes coronavirus disease in 2019. It is labeled in this way to avoid confusion with other coronaviruses. To put this all into perspective, we should be aware that in the U.S., in the current 2019 to 2020 flu season, we have had between 20,000 to 52,000 deaths from the flu. As of March 6th, there have been only 17 deaths from COVID-19 in the U.S., so we should be cautious, but there's no reason to overreact. The Surgeon General, Dr. Jerome Adams, said today we need to place preparation over panic, facts over fear. So here are some facts. Be aware that some of these facts will change over time as more information is revealed. Number one, the COVID-19 virus is of concern because it does have a much higher mortality rate per infection than the flu. The typical mortality rate for flu is about 0.1%. In China, the mortality rate for women from COVID-19 is 1.7%, and for men, 2.8%. The WHO finds that the overall mortality rate may be as high as 3.4%. However, this is much less than the MERS epidemic, where 25.8% of women affected died, and 32% of men who were infected with the MERS virus passed away. In other words, COVID-19 is over 20 times more dangerous than the flu, but only 1/10 as dangerous as MERS. Age is a big factor. The older you are, the higher the risk of mortality. It does not seem to kill young people. Based on current statistics, mortality for those 80 years and over is around 15%. Between 70 years and 79 years, around 8%. Between 60 and 69, about 3.5%. Between 50 and 59, a little over 1%. And it decreases as the infected people are younger and younger. Be aware that the coronavirus is actually relatively easy to kill. Both alcohol and chlorine can kill it. Lysol, Clorox, and even Purell have made the EPA-approved list of disinfectants. People should not wear a mask unless they have coughing or sneezing symptoms and you want to prevent the spread of your own disease. Or you might want to wear a mask if you're taking care of a person suspected of having a respiratory disease. Here are some precautions. Number one, don't panic. Number two, observe travel precautions. For example, there is right now no travel to China, and caution in traveling to countries such as Italy, Japan, South Korea, and Iran. Number three, avoid close contact with people who are sick. Number four, avoid touching your eyes, nose, and mouth. Number five, stay home if you are sick. Number six, cover your cough or sneeze with a tissue and then throw the tissue away in the trash. Number seven, clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe, especially an EPA-approved disinfectant. Number 8, do the fist bump instead of handshakes and limit public hugs and kisses. Number 9, follow CDC recommendations for using a face mask. The CDC does not recommend that people who are well wear a mask to protect themselves from respiratory diseases, including COVID-19. Face masks should be used by people who show symptoms of COVID-19 to help prevent the spread of the disease to others. The use of face masks is also crucial for health workers and people who are taking care of someone in close settings who are infected, such as at home or in a healthcare facility. Number 10, wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if the hands are visibly dirty. For more updates on COVID-19 and other tips for healthy longevity, subscribe to this channel and click on the bell for notifications. This is Dr. Shintani for your health.